Hello, my name's Melanie, and I am a grateful two-time receiver of a liver transplant. I was transplanted at Shands Hospital at the University of Florida in Gainesville, and my first transplant it began on February 7th, 2000. It ended on February 8th, 2000 because the surgery was actually 17 hours or 17 hours plus. And then my second transplant was April 21st, which was Good Friday that year, which we now call Great Friday. I feel very blessed. I really can't tell you a whole lot about pre-transplant. My family and friends really can. My diagnosis had been terminal, but I didn't know that. And so I just kept doing whatever the doctor said, and when I got the call, I was very grateful and went to Shands. And then post-transplant, my two surgeons came in, and they were very honest with me. They said one of three things would happen. They said, one, the surgeries that they would do would fix it, or that it would fix itself, or a retransplant. But looking at my original liver doctor that I had known for a couple years through the process, I pretty much knew that it probably meant a second transplant. And they're awesome people at that hospital and at the University of Florida and the healthcare system. And they were open and honest, but very loving and caring throughout the whole process. I went home, I was back and forth. I was very blessed that my oldest sister could come be my caregiver, and so she flew from California, and I was blessed that she could come for both transplants. The second transplant, I was actually in the hospital when that call came, and I had a drain, I was getting septic. I had hepatic artery thrombosis, and that's why I needed the second transplant. And after that, I had a little hiccup with some rejection, steroid-induced diabetes, because I was just coming off the steroids, and had the second transplant, and a little bit of C. difficile. So as it ended up, I just kept doing the next right thing, and it's been 18 years, and I do a lot to give back. I try to I'll go to the hospital and say, okay, who needs a visit? And I'll go visit whoever needs, because a lot of times at the hospital, you're there alone. Your family or friends are not in the city or not close. And so I'll go visit my golden retriever, and I will go and we'll visit patients. He's a therapy dog. And we go in and give bubbles and just show that, it can happen. You can go through a transplant and life is good. I do a lot of volunteer work for Trans Life, which is our OPO in Central Florida, and I've had the opportunity to go up to Dr. Starzl when he was alive at the Transplant Games in Pittsburgh and thank him. What a gift to be able to go up to the man that developed liver transplant. Thank you. I had no idea that would be possible. And there's so many gifts I can't even begin to tell you. When I was waiting, the most difficult thing was as people said, you're very sick. You need to pray for a transplant. And I couldn't, because at that time they were not doing a lot of living donors. But I was told that I could pray for the donor family, and that is something that I could do. So I did. I began to pray for, because somewhere there would be a donor family. And that I've done, and I've been blessed. I've been volunteering for Team Florida and attending the Transplant Games. I volunteer a lot with the Kidney Foundation of Florida because they do a lot about organ donation. I talk to schools, I talk to trauma nurses. Whatever I'm asked, I try to do to give back, because I feel so blessed that I've been given this second chance. I have heard from my donor families. It's an amazing experience to talk to donor families, and they look at recipients as their recipients. And You know, the main thing I want to convey is hope. Because if you're waiting for a transplant, I didn't know what to expect, and I just kept doing the next right thing, and I truly believe that prayers can be answered. My family, what a blessing, they've been very supportive, and no matter what you go through, the next day is a gift. I did lose my mom, which was difficult the year I had my transplants, and I couldn't be there, but on the other side, I was there for my daddy when he needed me. So, if anything, please know that I am grateful. I'm grateful to my donors in the medical field, that I'm grateful for today. Thank you.